Well, we're back right here on the program, and our first guest that we have this evening right here in the studio, we have with us Dr. Rosalind Wright, who is an associate professor of medicine at the Harvard Medical School and in the Department of Environmental Health at the Harvard School of Public Health. Dr. Wright, welcome to our show this evening.
Thank you very much for having me. It's terrific
nice to have you with us this evening right here on the weekend show. And maybe you could start out by informing our audience of the purpose of your visit to the state of Kuwait.
Well, it's terrific to be back to Kuwait. I'm actually working with a group of investigators from the Harvard School of Public Health and Harvard Medical School, and we've been involved in a number of projects over the years here in Kuwait, trying to understand specific environmental factors or experiences in Kuwait that can affect health of the population. Originally, Harvard got involved in some work specifically related to an event that happened almost more than a decade ago, which was the Iraqi invasion and occupation and the burning oil fires. And that's really evolved to interest a number of Kuwaiti scientists to work together with our group at Harvard to think about how to expand those studies and to continue to understand what's causing some of the concerning trends in certain diseases here in Kuwait. And we see these worldwide as well, and those include things like diabetes, obesity, heart disease.
All on the increase.
All on the increase, and respiratory diseases. And I've heard many times since I've been here, I'm a pulmonary physician, so my ears are very peaked to hearing about asthma rates and things. And that's another one that's people are seeing increased here.
Okay, now Dr. Wright, tell us a little bit now, inform our audience a little about the study that will be taking place right here in the state of Kuwait. Give us some details about that, please.
Yeah, this is actually, as I said, it's a very unique study in that we're very interested in children's health and the health effects of the environment on children. And rather than starting in childhood, we're actually going to start very early in development and think about what's happening even when women are pregnant with their children. So we all know mom's health is very important to children's health, but when you think about the environment, that can already start affecting the child's health, and not only the child's health immediately after birth, but as this child grows and goes on into adulthood. And there's some very interesting science that now says the roots of even chronic diseases like those we were talking about, cardiovascular disease, diabetes, in adulthood starts very early, even in pregnancy.
So what environmental factors do you tend to focus on? What are you going to focus on in this study?
Here in Kuwait, as in other parts of the world, we're very interested in dietary factors. So one of the things that might have caused this rising trend in some of these diseases is how the diet has changed over the last few years, several years, decades. And so we'll be looking at that. We'll also be looking at air quality and air pollution effects, and those things can start even when the baby's developing during pregnancy. And then also indoor environment, so things like allergen exposure, and those things can be important, particularly for respiratory disease. And then we're also very interested in emotional well-being and psychological factors. So also things like what causes worry or stress in these women's lives as they're pregnant and as they have their children and take care of their children and raise their children.
So why is it then important to do this in Kuwait then, Dr. Wright?
Right, because this would be a unique study here in Kuwait. It hasn't been done here in Kuwait. They are being done in other parts of the world. Why can't you do it just one place and get all the answers? Well, you really can't, because Kuwait's a very unique place. You have your own culture, your own customs, your own diet, very unique diet, much different than if I were doing this study, say, in the United States or Europe or other places. The air quality is very different. You're in a desert community. The climate is very different, and that means that the things that we see in the air and measure in the air are going to be quite different. So it's very important always to do it within the population that you're particularly interested in informing the causes of these things. And why do we want to do that? Well, the idea is not just to identify the causes, but it's really to look down the road and say, we'd like to prevent these from happening and decrease, see those trends start to decrease. And so we really need this kind of information, and you need it here in Kuwait if you're going to improve the health of Kuwaitis and those living here in the
society here. Okay. So now, how are you going about the process of selecting the let's say, pregnant women who will be taking part in this research?
Well, we want, in the long run, we really want the study to be representative of the entire population, all those who live in Kuwait. And of course, you can't get everyone, so we would like to go out into the prenatal clinics and do a very broad sampling of women across the society.
Different sectors.
Different sectors,
okay.
yeah. And that's the hope. And we're just starting now, and we're going to start doing that gradually as we go into one health center or hospital at a time and really work out the way to do that within each one.
So what phase are you at now in this study? Is it just the preliminary stage? Has there been a name chosen? Give us more details a little bit about how this study is going to take place. I'm sure a lot of our audience would like to know about that, and even the young researchers and scientists who may be watching would like to know how are we going to conduct this study, please?
Yeah, the practical nuts and bolts about how to have. Well, I first want to say there's been a great deal of planning that's gone into even where we are now. And what is that planning? That planning has been talking to Kuwaiti scientists, some of the research that we've done already with the earlier work that we've done together to explore what the factors are that we might want to focus on here. And then getting out and talking to the folks that are delivering prenatal care to these women, because it's a different time in development that we're interested in, and getting them engaged and interested and invested in the project. So we've done a lot of that. We've made built a number of collaborations. Of course, the support of the Dasman Diabetes Institute has been tremendous, and the nice thing about the Dasman is that that's a center that's very focused on education around improving health related to diabetes and caring for diabetes and providing health care and those sorts of things, but also has this vision that we also need to understand what's sort of contributing to this and how can we think about prevention down the line.
And I know the team that you're collaborating with at Dasman Diabetes Institute, very hard-working and dedicated to get this project off and going.
Tremendous, and what we've been able to do just in the last 9 months has just been spectacular. I've been involved in a number of these types of study and getting them up and running, and you know, the enthusiasm and the effort that everyone wants to put in is just really fantastic. So now, even in that relatively short period of time, we're ready to launch to try to go out and recruit women. The other thing I should say we did, I think that was extremely valuable, was to spend some time doing some focus groups with Kuwaiti citizens and pregnant women in particular, and ask them what are their concerns related to pregnancy, related to child health, and those. Do
you get a good feedback from them?
Very important to do that, because I don't know what the answers to some of those things, and I don't live in the society, and I can get those. I can ask those questions of physicians and others who live in the society, but really you want to hear from the actual people
women themselves.
Exactly, and I can tell you that they, you know, as women are everywhere, very concerned about children's health, and I think that they're going to really help us get this done. So that's very exciting. So we've gone through the training process now at the Dasman Diabetes Institute with the folks that we've hired to go out and meet with the participants.
Go out into the field, let's say.
Go out into the field, and this will be at the prenatal clinics, and interview the women, approach the women, tell them more detail about the study, make sure they don't have any questions about things that they'll be asked to do over the course of the study, and then once they volunteer to participate in the study, we'll be asking them a series of questionnaires, some of those things that I mentioned before about dietary factors, both for mom and then the babies once they're here, things that are in their home environment and those kinds of things as well. And then we'll be collecting different biological samples from them, very similar to what they give when they go to the health centers and get their clinical care. So it's nothing outside of the ordinary from that standpoint.
So this is, let's say, a pilot study, correct?
Yeah, we're doing what's called a pilot phase, meaning we're not doing what we hope to be the larger study. Eventually we'd like to enroll thousands of women during pregnancy and follow them and their children. That's the target
down the road for the larger study, correct?
Target down the road, but you never want to start that way and find out into that major process or commitment that you're doing things incorrectly. So we really want to take our time, figure out in the context of each health center, each one's a little different, how it works. We want to be able to go in and be not disruptive, but how can we
So
work
working at
within
a gradual
the
pace.
context? Yeah, and they help us do that because again, the physicians who are caring for the patients, they understand the importance of doing this kind of research for hopefully preventing problems down the road. And so they're very committed to helping us. And that's been very exciting, too, to see. And that, of course, is critical to the process, yeah.
So now, Harvard, who are they collaborating with on this study? Can you elaborate more on that, please?
Well, we've collaborated over the years with a number of different Kuwaiti scientists in the Faculty of Medicine, at the Dasman Diabetes Institute, as I've talked about, at KISSER. They're folks that are very interested particularly in dietary factors that might be contributing. And right now, our focus is really at the Dasman Diabetes Institute, particularly because we're very interested in that particular outcome as one of the things that we'll be looking at in the study over the years.
Okay, and I believe, as we said at the top of our interview, that you'll be presenting a lecture tomorrow, Sunday, March 13th at Dasman Diabetes Institute. Maybe you could inform our audience, give them a brief of what's going to take part. What's the lecture about? Can you tell us about that, please?
Sure. So it's geared more towards medical personnel and providers, and really it's to launch the study, to provide more of the scientific background detail that suggests the things that we might want to be focusing on in the study, also the research that's developed this idea that we need to really start looking at the root causes of these chronic diseases starting in pregnancy and in pregnant women and in early childhood. And then we'll talk about some of the findings from our earlier work that's going to inform where we go from here.
Okay. So that lecture will be tomorrow, Sunday, March 13th at 3 p.m., given by Dr. Rosalind Wright, and it is, like she said, open invitation for a lot of the medical professionals who would like to come out and learn a little bit more about the study and also attend the lecture that will be taking place tomorrow at 3 p.m. at the Dasman Diabetes Institute. Dr. Wright, now coming towards the end of our interview this evening, do you have any last comments for the audience watching right here in the state of Kuwait or wherever they may be watching around the world this evening?
Absolutely. I think one thing that Kuwait should be very proud. I really think that the work that's been going on and they've been supporting and we've been contributing to over these years as far as the faculty that participate from Harvard University, they're really taking a lead in the region to develop this kind of scientific infrastructure to really start to develop this type of public health research that's going to inform, hopefully, prevention and interventions. That's where we're really going to, in the future, start to see not rising trends in these chronic problems that we're all concerned about, but we're actually going to start to see a decrease in those. And I think Kuwait should take a great pride in leading that effort in this area.
Dr. Rosalind Wright, it's nice to have you right here in the state of Kuwait, and we wish you all the best of luck in your study and your work with the Dasman Diabetes Institute, as well as your lecture tomorrow at the Institute. Thank you for joining us.
Well, thank you very much for talking about the study.
It's our pleasure, and we were speaking to Dr. Rosalind Wright, Associate Professor of Medicine at the Harvard Medical School.